It is 7 minutes past 7. Now, the Health Secretary, Sajid Javid, has talked about the need for a booster programme on steroids to combat the threat of the Omicron variant. That will put pressure on the rest of the health service. GP surgeries have been told they can suspend regular health checks for over 75s to allow for more time to give booster jabs. GPs being taken off their daily duties could also have a knock-on with more people going into A&E. That in turn could affect ambulance services, and they are already in a desperate state. In a moment, we will speak to Rory O'Connor, who is a paramedic. But first, let's speak to David Nichol, who is a consultant neurologist based in Birmingham and a member of the Doctors Association. Good morning, David.
Good morning.
Do we have a sense of how many beds are being occupied by COVID patients at the moment in hospital?
Do I turn the question the other way around? It's more that everything that COVID does screws up the rest of the healthcare system. So that means, in terms of infection control, that has an effect on how we manage beds. That means if you're waiting for your cancer surgery, if ICU beds are being taken up because someone's got COVID, treatments potentially can be delayed. And, if you think in a normal winter before the pandemic, we've got one of the lowest number of ICU beds per head of population in Western Europe. Now with the pandemic on top of that, makes it incredibly stretched, and people having to make very difficult decisions.
And I'm wondering, from a doctor's point of view, how many of those people who are in hospital with COVID are unvaccinated? I'm just wondering if there is a frustration amongst doctors that those who are choosing not to take up the vaccine are taking up the beds and essentially preventing others from getting treatment.
It's very difficult, and I think people have got immune to the numbers. But I find it staggering that, in effect, 2 jumbo jets crash every week. Is the equivalent of the number of people who die of COVID every week, basically. And that is largely avoidable if people get vaccinated. And I know in my own trust, as of yesterday, 63% of COVID inpatients haven't been vaccinated. And that would be largely avoidable if they were. I think it's difficult. I work in inner city Birmingham. There is, quite a significant level of vaccine skepticism in parts of Birmingham. We know across the country there's around about 5 million people who've yet to have one vaccine, never mind a booster.
Does that frustrate you?
It is very frustrating, but I don't blame people. We need to keep engaging people with that. But even of staff, I'm looking at 80% of staff. So that's 20% of my hospital who have yet to have a vaccine. Now I think I work in a very good hospital, but my hospital is a reflection of the community it works in. I think having a booster scheme on steroids is appropriate, but also we need to also work with the people who have yet to have a vaccine as well.
Because that's the point, isn't it? Even if everybody who has been vaccinated already then goes through the booster programme, that's not getting us out of the woods if so many people are still not vaccinated even once.
Absolutely. And the reason for this, it matters so much, is because you get waning. There is so much garbage that comes out, basically. Personally, this has affected me. The only member of my family who died of COVID was the one who wasn't vaccinated. And I really can't emphasize enough, your listeners here, if you're not, I would say, switch on the radio, drive to the nearest vaccine centre and get vaccinated. It's so important.
I don't want to obviously get into the personal details of your family member, but you must have tried to have those conversations about getting a vaccination.
It was very distressing for my brother, yes. I think it's this dithering. I think dithering is the most dangerous aspect of this whole pandemic, is when the evidence is there that vaccination work or anything else, actually, wearing a mask and things like that. I'd emphasize also the importance of wearing a mask. Even the type of mask makes a difference. I would say, if you're in a crowded area, wear an FFP2 mask. Makes a difference as well. And all of these things really make a difference. And in the same way that wearing a seatbelt when you drive a car and obey the speed limit doesn't remove your risk of dying in a car crash, but it certainly helps.
Let's talk, if we can, about the government saying it's going to be okay for GPs to scrap health checks for the over 75s until April, if that's what they need to do in order to get boosters delivered. How worried are you by that?
Well, I think all of us have to make choices, and I think in general practice, and certainly my colleagues in general practice and Doctors Association really have done a fantastic effort. But we have to make choices, and it's about protecting as many people as much as we can, basically. And those, something has to give. You can't do absolutely everything.
The problem is, it's really important, those health checks for the over 75s. I was saying earlier on, my dad's prostate cancer was first picked up in one of those health checks. There will be many people who will feel that there is a potential that things won't be picked up. I'm looking at the text as I speak to you now. People saying there have been, so many hundreds of thousands of missed cancer diagnoses because people can't get to see the GP for a normal appointment because of vaccinations. And there are many people who are slipping through the net because of the vaccinations.
I know, but the way out of this is we're having to juggle many different things at once, basically. And if, let's say, as we know, there are 5 million people that aren't vaccinated, and some of those are getting sick, and some of those are dying. Okay, they are using up part of the healthcare system as well, basically, and that may mean it's harder for you. I mean, today, I'm actually having to go into work today because of staff sickness, okay? So, it affects all of us, okay? And, the system is very stretched. There's many people, thousands of people who are doing the best they can in trying circumstances. I absolutely accept that, that has caused delays and in some senses harm, basically. But all of us are trying to do the best we can in extremely trying circumstances.
And we're very grateful to you. Thank you for speaking to us this morning. It's David Nicholl, consultant neurologist based in Birmingham and a member of the Doctors Association. I'm pleased to